My name is Gao Zhang and I will be talking about the severe acute respiratory syndrome, also known as COVID-19. This virus appeared in February of 2019. It got its name from being part of the coronavirus family. It is an enveloped single-stranded positive sense RNA virus. This virus was found to be genetically related to the SARS that broke out in 2003. This virus is very contagious and can easily be transmitted. It has a viral size ranging from 70 to 90 nanometers, and when it is transmitted, it embeds its spike membrane and envelope surface protein of coronavirus into the host's membrane-derived lipid bilayer. It then decomprises the viral RNA. Although that is a complicated process that the virus goes through, it can easily be killed with bleach or 70% or more concentration of alcohol. This pathogen can cause respiratory tract infection, which it may be an upper respiratory infection that includes the sinuses, the nose, and the throat, or a lower respiratory infection, which is the windpipe and lung, which may also include pneumonia. So is this virus serious or not? It may cause some mild to moderate symptoms for some, like the common cold. Some symptoms that they may experience are fever, cough, tiredness, shortness of breath, difficulty breathing, muscle aches, chills, sore throat, runny nose, headache, and chest pain. While others that has chronic issues beforehand, they may experience other medical complications and possibly even die. So victims with chronic illness are more prone to severe illness if they catch COVID-19. Some complications that they may experience are pneumonia with trouble breathing, organs failure, acute respiratory distress syndrome, which that means that it is a severe lung condition that causes a low amount of oxygen to go through your bloodstream to your organs. Or they may even experience blood clots, acute kidney injury, and other additional viral and bacterial infection. Some of these groups are at higher risk, and some of these groups are elders that are 60 years and older, are diabetic patients, patients with heart diseases, chronic obstructive pulmonary disease, or cancer patients, victims that smoke, chronic kidney disease, or sickle cell disease, weakened immune system, and women that are pregnant. So this virus can be transmitted through airborne, which that means the aerosols or droplets stays in the air for a few minutes or a few hours, and that means it can be transmitted from patients that are infected when they cough, sneeze, breathe, sing, or talk. Another way that this virus can be spread is person to person, meaning you becoming directly in contact with somebody that's infected with the virus, or you touch a surface that has the virus, and then you touch it, and then you touch your mouth, eyes, or nose. So in order to prevent yourself from catching this virus, you should make sure that you avoid close contact. That means remaining 6 feet or more away from others. Make sure that you're washing your hands with soap and water for at least 20 seconds, or using a hand sanitizer that is at least 60% alcohol. And definitely make sure you're using a face mask to cover your nose and mouth because it is an airborne virus, and using eye shields when necessary. And also make sure that you're disinfecting high-touch surfaces, for example, doorknobs or keys, and staying home and away from others if you are sick or they are sick. As of right now, there is no vaccine that can cure this virus. And these are my references. Thank you for listening.